who is a young person who is joining us from Botswana. Gigi is passionate about transforming lives, poverty is possible only with greater engagement of the voices of the young. Having been actively engaged in advocacy and philanthropy since she was 5 years old, and I do need to get the gossip about this, I hope we'll hear about it now. She is a youth ambassador, a human rights activist and advocate, a former radio host, writer and poet. Currently, she is a political science student at the University of Botswana and a board member of the Global Partnership for Maternal, Newborn and Child Health, where she heads up the Adolescent and Youth Constituency. And perhaps just before inviting her to share her voice with us, I would like to take this opportunity to thank the many, many funders who have contributed to this meeting, because the 125 young people, of whom Gigi is one, are all here thanks to the support of our donor community. So if you could please join me.
Thank you very much, Suzanne, for that introduction. I think one thing that a couple of people don't know about me is that I'm also a farmer. So about 3 years ago, I was doing an outreach at a village that is not very far from our capital city, and I had actually organized a workshop for the farming community there to build that capacity on how to move from being subsistence to commercial farmers, and also doing some public education on food security. One of the farmers told me that her daughter had just given birth, who was 13 years old and would not tell them who the father of the child is. I was shocked, and I advised her to seek assistance from social workers for guidance and counseling. I also advised her to ensure that her daughter visits the nearest healthcare facility to get information and access to family planning methods. 2 years later, the daughter was pregnant again, now at 15 years old. The first time, she was not able to access the services because she was deemed too young to receive such information or commodities. One of the challenges we face is that of either not reaching adolescents, those who are marginalized geographically or by disability and other barriers, or reaching the ones that we have in schools and in urban settings when it is a bit too late. This is because, to a large extent, we still treat adolescents as estimates and that issues as assumptions. We also lack in aligning current interventions to current challenges and emerging trends in the lives of adolescents in order to safeguard their future. Adolescents are not only central to everything we want to achieve, but are also central to achieving it. Thus, it's not only about delivering better for adolescents, but also delivering better with adolescents. So in doing so, I have summarized my 6 key action points, and I make sure that they fit into the 10 minutes I've been allocated. The first one is political will and commitment. We must strive to motivate political will and commitment at the highest level to propel investment in the health, education, and well-being of adolescents. Instruments such as the Global Strategy on Women's, Children, and Adolescent Health should be aligned to our national development priorities to stand a chance for implementation. It is indeed not enough for a child to survive if we're not able to create an enabling opportunity and conducive environment for them to thrive, transform, and indeed realize their full potential. It's not enough for a girl child to survive birth while she faces the risks of being married off when she's 10 years old or being subjected to harmful cultural practices. When we invest in adolescents, as all the other speakers have said, our country stands great chances of reaping the demographic dividend. When we ignore the needs of such a large majority, we will have an army of angry, disempowered, and frustrated youth. Adolescent health is a critical sustainable development priority area that we need to get it right from the beginning. And ladies and gentlemen, let us understand that political will and commitment is not just in signing human rights treaties and attending high-level meetings. It is in increasing national budget for the health sector. It's in having adolescent and gender-responsive policies and programming. It's in strengthening the healthcare system in your own country so that even you as a leader is good enough for you and you're not a party to medical tourism. It is in harmonizing laws and breaking down barriers in your country to deliver better sexual and reproductive health and rights, especially those are related to protecting the girl child. The second one is on data, and I won't elaborate too much on that as other speakers have already eloquently talked about the need for data. But all I can say is that we say in God we trust, but in programming we need data. What is not counted does not count, and what is not known does not receive the attention that it needs. Human rights, and especially sexual reproductive health and rights, are just way too important to be left to assumptions. 3 is governance. Governance is often an ignored component of development, yet it is a major enabler. We can have the best human rights treaties and mobilize great support for delivering on health rights, but these cannot move when the country has major governance deficits. A girl child having much greater chances of being married off at adolescence than completing school is not just an issue of traditional religion, but a reflection of governance deficits. High prevalence of gender-based violence is not just an aftermath of patriarchy, but it also largely goes unaddressed because of lack of political will and governance deficits. And it is important to ensure that we undertake gender audits of policies, strategies, and programs, and ensure they espouse transformation to benefit both or all genders rather, and not only recognize but institutionalize ending gender-based violence. The fourth one is inclusion. We need to move more towards inclusivity and closing inequality gaps. And we must really strive and make deliberate efforts to reach the people that we tend to say hard to reach. I find it rather interesting and problematic that in all our countries we have the population that we call hard to reach population. But when we go to these localities, you will find a bottle of soda. When you go to these hard to reach communities, you will find political campaign merchandise. And sometimes it leads me to wonder, are they really hard to reach, or are we simply not prioritizing to reach them? The fifth one is to young people. It is indeed true that we must be the change we want to see, because we have to organize effectively or agonize miserably. As I always say, as young people, if you don't have a seat at the table, we need to dress comfortably to sit on the floor. Because at every cost, we have to be engaged and be part of the conversation. As youth activists and young development practitioners, we carry the voices of the most marginalized and voiceless, but also the hopes of being heard and seen with a promise for a much better future. We cannot let ourselves and our constituents down. The sixth and the last one is on innovations. Young people are actively innovating, coming up with solutions, but lack the capacity to launch them and scale them up. We need to support these solutions that enhance service delivery, access to information and services. Sometimes what we need is not necessarily a new cure for ailments, but perhaps we need to cure the way in which we work. I find something interesting in my country that agricultural demonstrators from the government go to the cattle posts, the farms and rural areas to give the cows the bolus. But we don't have healthcare workers who do such outreaches to immunize babies. Also in my country, you find the Department of Road Transport and Safety and the police send you messages when your car has been flagged or when you need to renew your vehicle registration. But we don't have a healthcare system that sends messages to remind you to go for testing, to go and get your medication, for all of that. I work with young people who are so active and want to innovate and want to change the world. One of them recently designed a glove, and this is for the community of people living with disability. And what happens is that if you don't know how to communicate in sign language, the person who signs puts on the glove and then they will sign to communicate what they want to say, and then an audio is going to come out of that glove and communicate to you so that they can access services. The other young people have designed bot systems that help in information dissemination, realizing that across Africa, data is so expensive, but Facebook is so cheap and in other countries it's free. So instead of designing a new application, why not have that information accessible inside Facebook? Others have been able to design health commodity management information systems, because we have many commodities that expire, we have commodities that don't reach the people on time, and this is a system that is ICT based and gives you real-time updates on commodities across the whole country, from even the smallest households. These are innovations that are coming from young people, and they're waiting for you to come and say, let's partner and work together and see how we can do this to enhance delivery of information and services. So in conclusion, let's ask ourselves the most important question in gatherings like this, which is, how do we move the conversation from these cool air-conditioned rooms and ensure that it results in impact on the ground? Dialogue on mapping the plan is always very important, but we should speak beyond rhetoric limited to conference rooms. We each have to make a decision daily that we will play our roles in safeguarding a better future for adolescents. Every day when the sun rises somewhere in the world, we celebrate the birth of a girl child. But also every day when the sun sets, that same girl child faces the challenge of either being married off or ending up as a teenage mother. Every day, we are accountable for the girl child who misses classes because she has her menstrual cycle and didn't have proper sanitary wear to give her the comfort, dignity, and confidence to access the same institution she could use as a gateway to a better life. 1.2 billion is not just a number, it's the lives of adolescents whose biggest hope lie in what we choose to do today and the next day. The future is a 10-year-old adolescent today, but the future begins today. We have the best instruments locally, regionally. We've had many dialogues, partnerships. What we need now boils down to 4 main points. The first one is action. Second one, action. Third one, action. And the fourth one is action. Viva young people!
And there is one action more to do, which is that I met Gigi the first time a year ago when George Patton and I were at the Women Deliver meeting, and in chatting to Gigi at that time and asking her about some future plans, she said she wanted to stand to be a member of Parliament in Botswana. And we asked her what did she need, and she said that she needed to raise $400 to do so. You have to stand, that's the fee. When I was having a Skype call with Gigi prior to this meeting, I was asking her, so how are the plans for government going? And she said, it's happening, but I need to raise the $400. So I did warn Anthony Costello that there was a charge here. Anthony last night at the opening ceremony announced that he was the self-appointed Goodwill Ambassador for WHO for adolescents. So Anthony, not necessarily personally, but on behalf of WHO and all of your contacts in the room, if you can't get some action to raise $400 to send Gigi to Parliament, you can do it on behalf of a whole lot of others. You don't have to do it from any of WHO. But as the WHO Goodwill Ambassador, you leave tomorrow night, and I'm expecting $400 to go to